All right, good morning, everyone. Thank you for joining today's event. While everyone's logging on, we're going to give it a couple of minutes so everyone can hop on today. And we'll kind of go over the instructions here in a minute, but we're excited to kick off this event with you all. Good morning, everyone. I see you are all logging on. We're going to give it a couple more minutes to allow everyone to log in today. We have quite a few hundred people joining the call. And the instructions are on the screen, but we will go over that here in a second. Good morning, everyone. Welcome to today's conversation. People are still logging on, but we're going to get started here in a second. But I do want to go over a few instructions with you today. Here in 1 second. All right, your video and audio are turned off today, but we welcome you to participate in the chat box throughout today's conversation. We also will have closed captioning available here in a minute, where you will be able to push a button at the bottom of your screen that says closed captioning. You will receive a follow-up email with the recording for today's conversation, along with any links that we post throughout the discussion. And you can follow along on Twitter by using our hashtag Laying the Groundwork Summit, or Laying the Groundwork. And then last but not least, have fun today. So I'm going to kick it off to Shannon.
Good morning, everyone. Thank you so much for joining us on this virtual platform. The entire team at Groundwork is really excited about today's presentation. I'm Shannon Jones. I'm the Executive Director of Groundwork Ohio, and I have the privilege of leading this amazing team of professionals that really make Groundwork work. A little bit about who we are in case you aren't sure or you're new to us. Next slide, please. Groundwork is the Ohio organization that's dedicated to policy and advocacy in the prenatal to age 5 space. We really champion high quality early learning and healthy development strategies because we know that these are the things that really lay a strong foundation for not only our kids and their families, but our entire economy. Next slide, please. What we do is we work with our local policymakers, our legislative leaders, the executive branch, as well as a vast array of diverse stakeholders and strategic partners to really promote data-driven and evidence-based policies and practices and investments. So if you're not familiar with us, we invite you to check us out on our website, and you'll learn more about us throughout this webinar. But without further ado, we can go to the next slide because, like I said, Groundwork is really an awesome team of professionals who are passionate about our youngest children and making sure moms and the families that support children are, have what they need to be successful. And so I'm going to start here with Lynn Ann, and we'll go through the list, and I'm going to ask everyone to introduce themselves on the team.
Good morning, everyone. I see the number keeps picking up. We have over 500 folks. I'm Lynn Ann Gutierrez. I'm the Assistant Director and Legal Counsel here at Groundwork. So excited to be here with you today.
And good morning, everyone. I'm Melissa Bacon, and I am the new Policy and Advocacy Director at Groundwork. It is really exciting to be here and see so many people interested in participating in this great event.
Good morning, everyone. My name is Chelsea Keaney, and I'm the Director of Communications and Stakeholder Engagement, and I'm really excited to be here with you all.
Good morning, everyone. My name is Ali Yagmore. I'm the new Operations Manager at Groundwork Ohio, and thank you all for joining us.
And good morning, everyone. My name is Julia Jacobs, and I'm a Policy Associate here at Groundwork Ohio.
Good morning, everyone. It's great to see so many have joined us. My name is Kelsey Hopkins, and I'm a Policy Associate here at Groundwork Ohio.
So that's our team. So it's small but mighty. And while we know many of you, there's so many we don't know. So feel free to introduce yourselves in the chat box and let us know you're here, because we have over 850 people registered for this webinar today. So thank you for joining in. It's great to make new connections. So next slide, please. So here's a little bit about our agenda. For those of you who've been with us for a long time, you know that we love to get together in person and talk a little bit about the budget, hear from those policymakers that are really involved in our policy areas, and are, we like to see you all and learn from you. And so it's a little disappointing to us that we find ourselves in this virtual world. We know that you are feeling the fatigue from the virtual world, but we're super thrilled that you thought this was important enough to join us this morning. So thank you so much. I still see people joining on our call, so I just want to remind folks that we will be sharing out all the materials. So if you're just joining us, you won't miss anything. What's really important about today's event is to remind you really how important your individual voice, your story, whether you're a parent of a young child, a provider who's providing home visiting services, a pregnant mom, a business leader who is concerned about the child care needs of their employees. Your story is really important to our success. And so thank you for using your voice today, and we hope that you engage with us. We're going to give you ways to engage with us to make sure that your voice is heard. What we're focused on is making this moment in time, this moment with all of this chaos and confusion that we know has been really difficult for adults, but certainly is equally and maybe more challenging for our children. Using this moment in time to really make this a movement. So as you listen to us, share your questions, share your thoughts, share your excitement in the chat box. My team will be including links to all kinds of resources to help you, making it as easy as possible for you all to engage in the work. And so as far as groundwork is concerned, if there is anyone that you want to bring to our effort, we invite you to share these resources with them too. So I think they're in the chat box. We're also going to have some social media prompts. So we encourage you during this event to be using the social media prompts so that not only your colleagues and your stakeholders know that you're participating, but let the panelists know, let your local legislators know that you care about this issue and that you want policies and investments that really support the work that you're doing in your families. So be sure to use that resource as well. So with that, one of the exciting parts of this job is being able to engage with some really important policymakers, and not the least of which certainly is Governor Mike DeWine. And we're really honored to have the governor participating with us today. We know how busy he is, but we also appreciate how much he really cares about our youngest children in the state. And so with that, I would invite you to check out the governor's bio that's going to be in the chat box, but you really know him already. But I'd love to get him on this call and share a little bit. But joining him is also going to be Kristi Burre, who is the new Director of Children's Initiatives. So she may be someone new to many of you, so this is a great chance to get to know her. Her bio will also be in the chat box. And so we invite you to read a little bit about her, and we've really enjoyed getting to know her over the last couple of weeks and deepening our relationship with the governor's children's initiatives. So with that, do we have Governor DeWine ready to address the group?
Hi, Shannon. How are you?
Hi, Director Burre. How are you?
Good.
Thank you for joining us today.
Sure. I don't know that he's logged in yet.
Okay, great. Well, we'd love to hear from you in the meantime, if that works for you.
Sure. You know what? Actually, Shannon, I do see that he might be on the line.
Okay.
Governor, are you on the line? Or Alexi, are you? Maybe they're just transitioning him. It means
okay. Well, why don't we put up Director Burre here, and we'll, as soon as we see the governor, we will turn it over to him. Sure. But Director Burre, we'd love for you to just share with our group. We have about 600 people on the line already. Sort of your vision for our young children in the state of Ohio.
Sure. Well, just quickly, again, my name is Kristi Burre. I'm the director of the Governor's Office of Children's Initiatives, and I'm not new, although I'm new to this specific role. I'm not new to children's initiatives in this administration, and was previously in serving as the director of our Children's Services Transformation Office at ODJFS. So have been very involved in the children's services and foster care reform efforts, and leading the Governor's Children's Services Transformation Advisory Council for Ohio over these first 2 years of the administration, and have worked really closely with Leanne and all of our cross-agency leaders for all of our children's initiatives work, which we're going to dive into deeper today. I'll pause just to see if the governor has joined us yet.
Hi, Director. The governor is not with us yet. He is planning to join at 10:15.
Perfect. I just wanted to make sure that he wasn't waiting for me. I would never want that to be the case. A little bit that I can, just a little bit of background too. Prior to coming to the state, I was working in the children's services space for almost 20 years in the county, at the county level and local government. So have worked closely in Franklin County, started out as a caseworker back in the day at Franklin County Children's Services, and had great opportunities to move back and forth between Franklin and Fairfield County JFS. And most recently, prior to moving into this role at the state, was serving as the deputy director for Fairfield County Child and Adult Protective Services. So I've worked really closely at a local level with the necessary community level cross-agency work, served on the Adam Board and the Family Children First Council and the Children's Trust Fund and Child Fatality Review Board. So have been a long-term advocate for the community level prevention work, especially with our early in the early childhood space for many, many years.
Well,
good morning.
Hi, Governor.
Governor, welcome.
Good morning.
Good morning. Thank you so much for joining us. Director Burre was just sharing a little bit with our group, her expertise, and we're really thrilled to work with her as we support you and your efforts in the prenatal to age 5 space. So with that, Governor, we'll just turn it over to you to share a little bit about your vision and your budget requests as it relates to young children and the moms and families who support them.
Well, Shannon, thank you very much. Thanks, everybody. I apologize. There's some noise in the background. I'm in a kind of a noisy car headed from Cedarville up to Cleveland. Fran and I got our second shot about 3 weeks ago, so we have been the last 10 days traveling around the state quite a bit and actually going to different vaccination sites, and that really is going well. We've vaccinated now about 2.5 million Ohioans, and we're moving up every single day. But it's really a joy to, frankly, after a year of being on defense to now be on offense, to have the vaccine and to be working to get it into people's arms as quickly as we can. When you go into a vaccination center, they're really a place of great joy and smiles. People are just relieved to get their vaccination. They can get back to normal. And as you saw in a little over a week, we're opening up to everybody in the state, and we just gotta keep going. But you all and I and our administration share the common goals. The way I like to explain it is the big picture is that we want every child in this state to grow up and to be able to live up to their God-given potential. And we know that there are impediments out there to that. And part of our job, I think, and a big part of our job is to remove as many of those impediments as we can. Whether that is a child who is growing up and is being poisoned by lead paint. In our budget this year, we dramatically increased the funds that are available in this area. You know, it's rather crazy and sad that 40 to 50 years after we stopped using lead paint in homes, that we're still battling this problem. Infant mortality and the great discrepancy that we see between African American babies and white babies is just something that we cannot tolerate any longer. We never should have tolerated it. There are programs, as you all know, home visiting programs and others that we are investing in and that we know absolutely change outcomes. And it's not just the infant mortality, it's also the maternal mortality. The mortality rate for African American mothers is appreciably higher than for white mothers. And that is, again, something that we, really have to focus on, and we are focusing on. So, maternal infant health, home visiting, early intervention, quality child care programs, early reading, these are all passions that we share with you. My wife Fran has been working very hard in regard to the Imagination Library, the reading part of what I was just talking about. And I would just, encourage everyone, if you have spread the word, we now have about a third of all Ohio kids who are eligible or receiving these books every month at 0 to 5, and they get a book a month that's free. And anybody now in Ohio, any child in Ohio is now eligible. So when we started a couple of years ago, when Fran started this project, just, a small portion of Ohioans were eligible, and our numbers were, way down. But now we're at a third. We're pushing to try to get up to a half of the kids and then just keep going from there. But getting a book in the mail is just an exciting thing for a child. And it really, really is helpful. I'm going to let, in a moment, I know you were hearing from Kristi. Kristi has a great background. Really happy to have her as our point person in regard to children's health issues, and she's going to do a great job in this role. So Shannon, why don't we just open it up? I know your time is limited. Kristi could go into the details, but I'm happy to respond to any questions that anybody has in regard to kind of what we're seeing out there and what our goals are, or just to listen to comments and suggestions for what you think that we should be doing.
Great. Well, thank you so much for that. And we too are excited about working with Director Burre. I want to let you know that we have over 625 people on the line. And so we've asked folks to put their questions and comments and concerns and praises of your agenda into the chat box. And we'll make sure we share that with you and your team so you have that feedback. But while I have you, I'm wondering if you could share for everyone who's listening in why you have been so committed to this area. Why do you think investing in that 0 to 5 space is so important for Ohio?
Well, Shannon, thank you for the question. One is kind of more visceral, more emotional, and the other is more intellectual. The intellectual side is that, I have seen throughout my career at the county level, state level, federal level, now back to the state level, that what happens with the child in the first 5 years or 6 years of life is just so determinative of, their ability to live up to their potential. And, we know so much more today than we did 5 years ago, a lot more than we did 20 years ago. And that is, the science just clearly shows that the biggest bang for the buck, if you want to just, look at it from a dollars and cents point of view, I don't usually look at it that way, but if you want to look at it that way, is the investment in early childhood. That's where you can have the most impact. I think the other is more emotional, Shannon, frankly, more visceral. Fran and I are the parents of 8 children. We now have 26 grandchildren. We have just seen it with our own kids. We know how fast kids can develop, and we know that, personalities are formed, patterns for life are formed in just those first few early years. And just seeing that through our own kids, seeing that through our grandkids, seeing how important it is to read to children, seeing how important it is for children to have emotional support, to have structure, kind of all the things that we, really know. But Fran, I've just seen this personally, and it just, so that is really, one of the things that drives us. I said in my inaugural speech that we should have the courage and the guts to invest and do things where we're not going to see the immediate results. And, there won't be any economic benefit immediately. And that investing in early childhood is really that. I mean, we know for the long-term good of the communities in Ohio, long-term good of all the people in Ohio, focusing on kids early on, there's nothing more important than that. But we also know, it doesn't really, quote, pay dividends for maybe 20 years. And so, candidly, sometimes it's difficult for people in public office who want to be able to show immediate results. There's a tendency not to invest in something that's not going to show a result until, we're out of office. And candidly, what we're doing now will have some immediate impact, certainly, but the real big impact will be long after I'm gone as governor, and will be in the years ahead when kids that we're, reaching out to now are 18 or 19 and are moving on or not moving on, depending on what that investment is. So this is really what we care about. This is what we have a passion for. I saw it also when I was a prosecuting attorney, and the first cases I handled as a very young 25-year-old assistant county prosecuting attorney were children's services cases, where I went into court and represented children's services, and I saw sometimes the terrible things that adults do to children, and that really formed my opinions. It really struck at me very hard just to see that, and I kind of resolved that whenever I had the opportunity to improve the situation for kids who are living in difficult circumstances, that I certainly would do everything I could to try to do that.
Well, that's, for those of us who have known you for a long time and have followed your career, know that has been a consistent issue for you. And we're so grateful for your leadership on these issues. We have the opportunity now with 635 or so people on the line. We're talking about parents, early childhood providers, home visitors, business leaders who care about quality childcare for their employees and having a workforce for tomorrow. What would be, in closing, what would be your advice to them during this budget process? How should they be communicating their interests and concerns with you and members of the General Assembly? What's your advice to them?
Well, you've got a great group. That's an amazing group of people on the phone now. I guess my advice would simply be, make your opinions known to your own legislators. Legislators really pay attention to people who they directly represent. And that's just true on any issue. But I think, anytime you have the chance to get to know a legislator, anytime you have a chance to talk to a legislator about these children's issues, you ought to take the opportunity to really do it. Legislators do care. They care about their own constituents, and there's no one more influential than the people that they directly represent. Most people don't take that opportunity. Most of us, most people vote. We hope that they vote, but that is many times the limit of what they do. But you're in a unique position because of what you know, because of what you see, what you feel, what you care about, to share that passion with members of the General Assembly. And you should never underestimate the power of one person, with a well-crafted letter. That is not a form letter, but it's a letter from your heart and what you've seen, or a visit to a legislator, a call to a legislator. Those things matter. They matter a lot. So I think that would just be just a reminder. I think everybody knows that, but sometimes we need to think about it and need to fully appreciate what would move you if you were a legislator? What would move you if you were dealing with public issues? So just some thoughts.
Well, that's really helpful. Thank you for that feedback, Governor. And everyone on the line needs to know that we'll be providing them with lots of easy opportunities to engage with their legislators. And I think hearing from you how important that is will ensure that people really lend their voice. With that, Governor, I know you're on your way to another event. I'd love to turn it over to Kristi for a closing thought about some of your key priorities. But before I do that, I want to ask you if there's anything else you want to make sure that this audience knows about.
No, I'll just turn it over to Kristi, and Shannon, thank you very, very much. Thanks for everybody being on here. Thanks for caring about these kids. Nothing more important in our lives. Thanks a lot, everybody.
Thank you, Governor. We really appreciate your leadership. And Director Burre, I'm wondering if we can just, because we have so many parents and families who are participating in this call, I'm wondering if you would be willing to just share, as someone who is responsible for implementing the policy goals and vision of the governor, how you view the voices of families and the moms and dads who are taking care of children, and the pregnant moms. Can you provide us with any insight as you know, this tremendous policy leader, and how those individual stories impact your work?
Sure. Thanks, Shannon. You know, as we all heard from the governor, his vision for what we need to prioritize for children and families has remained the same as it did from the very beginning in his original Opportunity for Every Ohio Kid plan. So even though we're going through some of these transitions, you know, my vision and my priorities are his vision, and all of those important things that we started out with and that we will continue to prioritize going into this next biennium. As it relates to hearing from the voices from our families and our children and our youth and our caregivers and our workforce directly, it is something that I'm passionate about, and that we've really tried to elevate and prioritize. Our work in the children's services space over the last couple of years, you know, we brought together an advisory council, but we didn't even start talking to each other until we traveled around the state. And that was prior to the pandemic, of course, but we traveled around the state and just listened to anyone and everyone that was willing to share their story. It was difficult to hear sometimes. And there were some really courageous conversations that helped throughout that process. And although we had expertise and experience and lived experience on that advisory council, it was always embedded in the what we heard and what we saw and the realities of what's happening around the state. And we're doing the same thing. I'm excited because we're modeling the new Eliminating Disparities in Infant Mortality Task Force process in the same way. So that is a new task force that the governor, Shannon's appointed to that. The governor just announced at the end of the year, we had our first task force meeting this week, and that was just to kind of get us all together and you know, launch what the next phase is going to be. And same thing again. The governor is passionate about listening to the voices of those in communities. So we need to hear from families and mothers and women, particularly in our Black communities, to hear their voices, their stories as to what their experiences are, and not just listen to the stories, but make sure that the right people are at the table to be part of the decision making and inform all of those decisions. So it's absolutely critical, and it definitely will continue to be a priority moving forward.
Well, we're grateful for that, and I'm putting my team on the spot because I'm going to ask them to put in the chat box ODH's invitation and application for local communities to hold these listening sessions. I know that the task force is really committed to hearing the voices of our Black moms and pregnant women, and we know that communities need to be a part of that. So I hope that of the more than 625 people who are on this call right now and might have an interest in hosting such a session in their community, they will check that out. I don't want to put you on the spot, Director. We would love to have you stay for the panel as your time permits, but I'm going to turn it back over to Lynanne. But before I do that, I'm going to ask you the final question. Is there anything that you want to make sure this audience is aware of that we need to know about? And we do really would love for you to stay on if your schedule permits.
Okay, thank you, Shannon. I'll just end with this. Although my career, and I might have said this to you a few days ago, Shannon, my career has really been in the deeper end of our system, the back end of the system, multi-system youth, families and children that are suffering the most or that are experiencing the most challenges in our child protection system. But I've always been an advocate and passionate about the fact that it's not just about the Children's Services Agency. It has to be about the entire continuum of care and supports and partnerships that we have across all of our agencies. And I think that that's really important. We have amazing recommendations for transformation and reform for our most at-risk kids and families in the state of Ohio. And I have, we're moving forward and those aren't recommendations that are going on a shelf. We're going to hold ourselves accountable. We're going to continue the work out in the counties and the communities to be transparent about where we're at with the process. But what I just want to leave us with is none of that is going to matter unless we prioritize more time and efforts and energy on everything that we're talking about here today in this early childhood space and prevention work further upstream. So our priorities revolving around childcare, revolving around prevention and school-based health and mental health supports and wraparound supports and evidence-based home visiting and mother and infant health. I mean, all of that, it has to be the priority. That's where we need to focus and do better so that we don't have kids and families even needing those deeper end services and system needs later in life.
Well, thank you for that. We love to hear all of the talk about prevention, and you can count on Groundwork and all of our stakeholders to partner with you to that end. So
Great.
Thank you, Director.
Thanks.
So Lynn-Ann, I'm going to turn it over to you to kick off our legislative panel.
Thanks, Shannon, and thanks everyone again. We're going to move right into it. We are really lucky to have, especially after hearing from the governor, an incredible panel of Ohio House representatives, of legislative leaders that have key roles in this state biennial budget process. Just a note on where the budget process stands. The governor introduced his executive proposal. So his proposal about how to implement his priorities that you heard about throughout what is the largest investment opportunity that the state has. It dictates appropriations for nearly all of our child-serving agencies throughout the state for a 2-year period of time. So this is a big opportunity for all of you to elevate your voice and to hear how legislators are filtering the information that you're sharing with them and how you can be part of the process. So let me introduce our panelists. Here in alphabetical order first, this is Representative Kristin Boggs. She is the Assistant Minority Leader. She represents the 18th District in Central Ohio. We're also joined by Representative Crawley. She is the Ranking Minority Member on the House Finance Committee. She represents the 26th House District, also in Central Ohio. And then we are joined by Representative Bill Roemer of the 38th District. So that's parts of Summit and Stark County in Northeast Ohio. He is the chairman of the Finance Subcommittee on Health and Human Services. And we are also finally joined by Representative Bill Seitz of the 30th District in Hamilton County, so Southwest Ohio. And he is part of the majority leadership team in the House. So thank you all so much for being here to talk with us. We have a panel format that has 3 questions. A couple will be the same and one will be unique to each one of our panelists. And as we see their faces pop up here shortly on the line, I'll ask them to allow us to see them. So to begin their video, make sure you are unmuted. And I'm first going to ask each panelist to answer the same question. You have about 2 minutes to just share a little bit about who you are, how you're engaged in work that's responding to the needs of young children and their families in the budget process, and a little bit of your insight on why you may believe this work is more important now than ever. I'm going to start with Representative Crawley, if you could answer first.
absolutely. Can everyone hear me okay? I hope so. Okay, great. I just want to say thank you to Groundwork for inviting me to be on this panel today with my esteemed colleagues. It is an absolute honor and a pleasure to be here with you all today. And I see we have a number of childcare providers, parents, all on the call. So thank you all for being here. So just simply who I am, I say I'm a mother, I'm a veteran, overcomer, and an advocate. And so how I've been like engaged in this work or what I'm looking for during this budget season, I would say I am, pushing some of the policies that my caucus has put forward, looking for funding proposals that put families first. So if you work hard, you should be able to get ahead and live a life that provides safety and security so that people can thrive and not just survive. We like to say that you should be able to live the American dream right here in Ohio. So I'm looking at things that prioritize access to childcare and early childhood education. Are we providing more access for 3 and 4-year-olds? School funding is a big issue and a big topic right now. So like, how will that get handled? And are we taking care of our children, making sure that our funding formula is equitable? And addressing the needs of the unhoused and housing affordability and increase in wages for those who take care of our most vulnerable and aging populations, college affordability, and opportunities for people to gain skills or be reskilled as we are going through the pandemic and people, have lost their jobs and are unable to put food on the table. And I think the other thing that we continue to push and that I continue to push is racism as a public health crisis. And so I know some of my colleagues, not all, have not wanted to engage in this conversation. However, this is not to say, you're a racist or that person is a racist. That is not the goal at all. I just want to put that out there. What is the goal is the goal to acknowledge that racism does exist. It has existed, and we have codified these things into law, unintentionally or intentionally, things like redlining. So we know that redlining is not supposed to happen today, but we know that it had previously, and that has been the driving force for the social determinants of health and things that have created the barriers and the conditions where people are living in poverty, have lack of access to food, and live in food deserts. And lack of access to quality education. And I'm sure you all talked about infant mortality and things like that. So, I'm looking at how we can have a conversation and address those things that keep people behind and deteriorate our communities. And whether we acknowledge it or not, racism and discrimination costs everyone. As Heather McGee would say in her book of The Sum of Us. So that's what we're looking at. How do we put families first? How do we all get ahead and take care of everyone, especially during this pandemic?
Thanks so much, Representative Crawley. And I know we've been supportive and will continue to be around the declaration of racism as a public health crisis. Let me move on to Representative Roemer. Can you share a little bit about who you are and how you're engaged in this work?
Good morning, everyone. It's great to be here. I was lucky enough to retire as director of sales for AT&T and started teaching and tutoring, and I've spent the equivalent of 3.5 years in the classroom, and also was president of the baseball league, and had a chance to work with a lot of kids that way. Ran for the House, won my second term, and the speaker decided it would be appropriate to have me be the chair of the Health and Human Services Subcommittee. And I say this, but we have an amazing team. Representatives West, Lips, Edwards, and Russo and I, we spent 24 hours listening to direct testimony, 7 panels, 600 pages of testimony, 164 witnesses, and innumerable calls. What we're doing is we're looking at the entire continuum of health and human services, starting with, children as they're born all the way until grandma and grandpa in the nursing home. And what we're working to do is we're working to balance the funding across that whole continuum to make sure that we're getting the best bang for our buck. And at the same time, I will say there's a difficult process. The effects of the pandemic on the state budget, the additional people that are utilizing state services, we really, really have to look tightly at every facet. So early childhood education is very important, as are these other things. It's a real balancing effort. And I'll leave it at that, and I would be very open to questions.
Thank you. Well, we'll come back. We have more questions for you. I'm going to move on to Representative Seitz and ask him to introduce himself a little bit and how he's engaged in this work. Representative Seitz, if you happen to be talking, I can't hear you.
Okay. You hear me now?
Yes, sir. Thank you.
Well, there you go. It's a joy to be with you all this morning. My name is Bill Seitz. I've been in the state legislature for over 20 years now, both in the House and in the Senate. And I currently serve as the majority leader for the Ohio House. I've been fortunate to be part of majority leadership for a goodly part of my time in the House, having now served in that capacity under 5 different speakers of the House. So it's been a long run, but actually I think more to the point of this meeting, my first elected job was as a member of the Cincinnati Public Schools Board of Education, and also served on a parochial school parish education commission. So I have a lifelong respect for the need for education, and particularly early childhood education. I have 2 daughters-in-law. One is a Cincinnati public school teacher. The other is an early childhood education degree. That's how she got her degree from Purdue. And I have 6 grandchildren, and all of them have learned to read before they got to kindergarten. So I understand the importance of early childhood education. Little perspective, having served for 20 years, this movement started really about 20 years ago with a program called Help Me Grow. And a lot of folks were very reluctant to embrace that program because they were worried that the government was going to start intruding into family situations when in fact that was never the intention. So some of the titans in your movement are folks that I've worked with for all of that period of time. Folks like Judy Van Ginkel, who started the very successful Every Child Succeeds program here in Cincinnati, and Margaret Hulbert and Sally Westheimer from 4C Cincinnati, who were leaders in the whole Step Up to Quality movement, which is very important for getting quality childcare, not just babysitting, combining education with quality. And of course, then in the Senate, working with then Senator Jones and Senator Layner, we worked ceaselessly over the period of time we were together to increase the amount of money we're spending on early childhood education. Because with the 3rd grade guarantee and other things like that, it's more important than ever that we try to get all the kids up to the same starting line when they start kindergarten. And that's why early childhood education is so important. So I think that's enough by way of a little bit of background, and I look forward to continuing to participate in this panel with my good colleagues.
Thank you, Representative Seitz, and we appreciate all of your leadership and experience over such a number of years. So I'm going to move on to Representative Boggs as well.
Well, good morning, everyone, and a big thanks to Groundwork for hosting us, and certainly I want to take a second to just thank all of the childcare providers that are tuning in today. I'm Kristin Boggs. I'm the state representative for 18th House District, but I am also the mother of a 2-year-old and a 4-year-old, and so for all of the childcare providers, I just want to acknowledge what a difficult year this has been for all of you, and the fact that so many of you have stepped up in incredible ways throughout this pandemic, even jeopardizing your own safety, your own health to continue serving our kids. As a mom that relies on childcare, I couldn't have gotten through this year without you. And so just a huge thank you for all of you that are tuned in today. I represent the 18th House District, which includes downtown Columbus and some of the first ring suburbs of Columbus. And my district is really unique. I have the highest population of 18 to 25-year-olds in the state, and half of my population is under the age of 50. So when you think about Ohio, we're an aging state, but that is not what's happening in my district. I have a lot of young families. I have a lot of young people. And so I spend a lot of my time talking to my colleagues about what young families need in order to get by and what young people want to see from a policy perspective in Ohio to choose Ohio as a state where they want to live and raise a family. And childcare is a huge component of that. It is really time that the state take a hard look at making some serious investments in childcare, and not just for the families, but also for the providers. And I've seen in the chat this morning just the inequity in terms of what our childcare providers are able to make as an income. The fact that the workforce behind the workforce isn't fully seen is a real big problem in this state. And so I consider a lot of my responsibility as a family that depends on childcare for me to be able to go to work and for my husband to be able to go to work, to be a voice for that workforce, and that they need to be seen, they need to be heard. And we really need to start taking better care of all of the people that take care of the people we love.
Well, thank you so much, Representative Boggs, and the entire panel. You all are such incredible leaders that you've already kind of sunk into our second round of questions because you got straight to the important content. But I'm going to return to you, Representative Seitz, and you shared certainly what your experience has been over time, and particularly the development of investments in your local community. Can you share more specifically in the budget how that shaped your understanding of early childhood systems and informed your view of state investments in early learning when given the incredible investment in your district?
Well, the important thing that we've done over the years, besides increasing the amount of money we're putting behind these very important programs, is putting money behind programs that are both evidence-based and data-driven. And we've had a head start since the early 60s, but there really wasn't a good body of evidence to substantiate that it really worked. So the beauty of programs like Every Child Succeeds, and the beauty of programs like Help Me Grow and the Step Up to Quality, is that we're now not only spending the money, but we're collecting the data and the evidence that proves that this makes a real difference. And so I think that is key. And that was also key to being able to convince my colleagues to continue to increase the amount of money that we're spending. Now, relatively recently, we began supporting, and in Governor DeWine's last budget, there was some $600 million for wraparound services in our schools. And that's a wonderful idea. But the original wraparound service model was developed here in Cincinnati at Euler School. And I worked very hard with then Representative Denise Driehaus to replicate that across the state. I'm a little concerned that the way in which most public schools have implemented wraparound services is not really true to the Euler School model. And so we'll be looking, and I know the governor shares this concern because I've talked to him about it. We want to be sure that as we roll this out, it looks more and more like the Euler School model, which really brought private agencies, local businesses, local health departments together. It wasn't just run out of the public schools with their own personnel. So I think we are going to be looking carefully at trying to maintain that money, but let's be true to the original wraparound service model. That's one thing. So again, I'm all for spending the money as long as we have guarantees that it will be spent in a correct way and that it will achieve the results that we all want. And so you have to be careful about that so that you're not just throwing money at a problem, you're also leveraging that money as best as you can with other private providers and other businesses and other nonprofits. So there's a need for lots of you folks to work together. The early movement that began with Help Me Grow and that has now sprouted like 1,000 blooms, and as evidenced by the fact you got 600 people on this call. So we need to coordinate, and I guess that's what Kristi Burre is going to try to do. And of course, that's what Groundwork does. So I would just encourage you to keep doing that and try to coordinate these efforts as best as you can. It'll produce better results.
Thank you, Representative. I'm going to turn to Representative Boggs. You certainly have been generous with your time during the pandemic and have continued to share how you being a parent informs you being a policymaker, which I think is true for all of us parents in terms of what we prioritize. Can you dig a little deeper into how your position on childcare and access to childcare has developed further during this pandemic period of time?
Sure. I think that, and I've said this several times, and I'm sure people on this call will hear me say it 100 more times. We really have to start thinking about childcare as a piece of our workforce infrastructure. I can't get to work without roads. I can't get to work without childcare. And throughout this pandemic, I think we really saw the impact of women not being able to work because they didn't have access to childcare. It is as critical as any other piece of infrastructure in order to get people to their jobs. And I think that when we look at this past year and what COVID has done, and we see the amount of women that have left the workforce, just simply the way we talk about that. I hear sometimes my colleagues talking about it as, she chose to stay home during this time. It is not a choice. It is not a choice to stay home when you don't have access to childcare, when you don't have some place that your kids will be safe and secure and healthy. It's not a choice. You have to take care of them. And so if we don't really start talking about childcare as a workforce infrastructure piece, if we don't stop talking about it as just a women's issue or a children's issue, we're going to leave a lot of people out of this economy. We're going to leave a lot of dollars never made, because it's about jobs, it's about economic growth. And if we're going to get out of this pandemic, if we're going to economically recover from this pandemic, we absolutely need to be thinking about getting women back to work. And what does that mean? And a huge key component of that is making sure that they have some place that is safe, secure, accessible, and reliable to take their children.
Thanks so much, Representative Boggs. And Representative Crawley, I'm going to run you and ask that you talked a little bit about how you're kind of evaluating the state budget and your priorities. Do you feel that the needs of pregnant women and our youngest children are being met? And how are you evaluating those needs with an equity lens, particularly in the maternal and infant health space? How could we better serve children and families?
Absolutely. Thank you for that question. And I probably will echo some of what Representative Seitz said and Representative Boggs. So if you look at my bio that was placed in the chat, my background prior to coming into the legislature, prior to going to law school, have been in the early childhood space, from working with the YMCA Head Start or Early Head Start program, or the Black Child Development Institute, helping child care centers get accredited on a national level through the National Association for the Education of Young Children. But as someone who has twin girls at the age of 23, who was a recipient of Help Me Grow, right? I do understand what it's like from a personal perspective, but then also serving children and families. And so while I don't believe the governor's budget is, a terrible proposal at all, there's no tax increases, no tax cuts, I do believe that the budget does fall just a little bit short of providing support for pregnant women and our children, given the pandemic and the negative economic impact that it has. I mean, I think this is where my colleagues and I can, put those priorities forward and put more money to them. So when we look at the infant mortality rate, especially for Black babies who are dying at 2.8, 2.8 the rate of white babies, we've had evidence-based initiatives in place like Help Me Grow for a long time, and we continue to invest in that, but we don't see the returns like we would like to see with Black babies. And so I think we should be targeting those funds to other evidence-based home visiting programs that we know, like Restoring Our Own Through Transformation Route, or Black Birthing Beautiful Communities, where they have seen not lost one mother, haven't lost a baby with their home visiting programs or their doula programs. And so I think we can do better there. When we talk about step up to quality, last year in the last biennium, I was really trying to make sure that there was an investment to support providers, especially in our childcare deserts or in rural communities where they were desperately needed. So I would be looking in this budget to make sure that we have a stable funding source. And I know Step Up to Quality is funded in 3 different ways, but stable funding source to make sure that our providers continue to provide quality childcare and they can move up that rating system. And so I think also we need to be looking at Medicaid reimbursement for doulas, because we know Medicaid pays over 51% of the pregnancies here, or Save Our Mothers Act, which helps us get to becoming an AIM state, which is the Alliance for Innovation on Maternal Health. We know that patient safety bundles, when they are implemented, in states that have done that, it has decreased the infant mortality rate and the maternal mortality rate some by 50%. Increasing childcare eligibility. Because we are in a pandemic, we know that the need is great. So the governor has increased it to 138% from 130. I think my colleagues and I can do a little bit better than that. If not going up to 200%, then at least 150. And so, also with domestic violence centers, we know that abuse and mental health has taken a hit, as well as domestic violence those cases have increased, especially around like strangulation and things like that. And we also know that those things, whether it's toxic stress, lends itself to infant mortality. So I think, when I look at the budget and the governor's proposal, I think it is good. It's a good start, but my colleagues and I can definitely make it better.
Thanks very much for your comments. Representative Roemer, I'm going to end with you in this round of questions. As you're evaluating the governor's proposed budgets and the numerous amendments you mentioned in some of your committee metrics that represent the needs that our youngest Ohioans and their families, can you share what common themes have arisen among public discussion and where there may be opportunities or interest for you and your colleagues to learn more about the needs of young children and the state systems that support them?
Certainly, and let me start off by saying I served for 3 years as vice president of the Summit Education Service Center, and we did a tremendous amount of early childhood education as part of the Summit ESC. Coincidentally, my wife now serves there after I left. We heard a number of themes as we went through HHS and the people that reached out to me. Multi-system youth and the issues associated with that. Childcare funding, of course, and we're working on that. Kinship care funding, the breakdown between what the state is going to do, what the counties are going to do. Difficulties of the pandemic on children, specifically mental health, foster care, all of those things. We've looked at. What I tried to do is look at that in light of what's the return on investment. If we put more dollars into something, what do we get back from that to make sure that we're spending our dollars in an appropriate manner? One of the other overarching themes we heard all the way from birth to death is what happens on the workforce development side. Because, we had testimony that it's really tough to get people to come to work when you can go to Amazon and earn $15 or $18 an hour versus caring for our children or caring for our grandparents. So that's one of the overarching themes we're looking at. As we've looked at amendments and looked at budgets, what we've looked at is, again, the return on investment. What are we getting back for the dollars we spend? Are there demonstrable increases in educational results, in reductions in infant mortality, in increases in women's health? So those are all the things that we're looking at as we go through the process.
Thank you very much. I'm just going to end with asking the same question of all panelists, and I'm going to actually start back with you, Representative Roemer. There are certainly hundreds of early childhood advocates on the call demonstrating they're trying to communicate that this is a priority for all of them, both to the governor and to you as policymakers. What would be your advice to them as they seek to elevate their voice and the experience of children and families to inform the state budget? So what do you need to hear from them, and how can they best communicate with you and your colleagues?
Maybe talking about what Governor DeWine had said. Don't be afraid to reach out to your state representative. And the governor, I believe in his comments said, you know, a well-written letter is really appreciated, or a personal call. As representatives, we receive hundreds and hundreds and hundreds of form emails on a daily basis. I do my best to personally actually read each one of those, but that personal contact with your state representative is most important. On the days I'm not in Columbus, I have between 5 and 10 individual calls and conference calls set up. And those are the areas where I really learn more about the process, about what we need to do. So it's that personal contact with your state representative that's really, really important. And I think the governor said something like, you know, one person can make a difference, and they really can. You'll see when you look at bills that are introduced, sometimes it's one person's experience working with their representative that led to a big, big change across all of Ohio. So don't be afraid to reach out.
Thank you so much. Representative Boggs, can you address that question?
Absolutely. And I agree with Representative Roemer. You know, certainly the personal contacts with your state representatives are incredibly important. But I also think it's really important to try and speak with a unified and organized voice on this issue. You know, there is certainly such an enthusiasm from, and I see the chat box, you know, going at rapid speed. I know that there's hundreds of people on this call. Your unified voice on these issues makes an incredible impact. And so working with organizations that can unite you in your agenda, in your legislative agenda, I think is incredibly important. And to the extent that you can use your shared consensus and agreements on what the changes are that need to be made, and speaking together as one large group, I think that makes a huge impact. And any efforts to organize in that regard can be very powerful.
Thank you so much. Well, we hope that Groundwork is one of those key and leading organizing factors in our state. Representative Seitz, can you address that question? How can the folks on the call get engaged and have their voice heard?
Well, I think my colleagues and the governor did a nice job of outlining good ways to reach out to your representatives. I would take a step back, and I would remind everybody that Rome wasn't built in a day. Your state representatives are grappling with myriad worthy requests for additional funding all the time. Our elderly, the folks in assisted living, the folks in nursing homes. There's a million worthy causes. K-12 funding. The representatives are not heartless. We're simply trying to manage through all of these different issues. So when you come with your pitch, that's great, but just understand at some point we have to put together something that's in balance. We can't just print money the way the federal government can. So that's number one. So understand that there are limits to what can be done in any 2-year budget cycle. 20 years ago when I started, there was none of this. Really, truly, the strides that we have made in 20 years, and you can ask Shannon Jones, have been tremendous. I mean, they're not enough. Everybody agrees with that. But looking back to 20 years ago, these programs were simply in their infancy, and other than Head Start, there really wasn't much in the way of early childhood education, and there wasn't much of a child care program. There wasn't a school-based health clinics in most schools. So understand that Rome isn't built in a day. You've got a bunch of people, whether they're Democrats or Republicans, that believe in the cause that you're espousing. So we don't need to be sold on the worthiness of the cause. We need specific examples of how we can make things better. I'll give you one closing example. When the pandemic first struck, a friend of mine who runs a nursing home in my district said, since the child cares are closed, if I cannot get a temporary emergency license from the state to put child care in an adjacent building to my nursing home, my nursing home workers are not going to be able to come to work because they can't get the child care at the place where they used to get the child care. And I said, well, that's a very, very worthwhile thing. So I worked with the Ohio Department of Health, and lo and behold, we had emergency child care licenses issued for the first 90 days or so of the pandemic. There's a specific example of a specific constituent with a specific problem, and it's something we were able to get done. So again, shoot for the achievable, understand that we're all busy people and we're all well-intentioned, and we will work together to do as much as we can within the confines of all the other competing interests that we have to juggle all the time.
Thank you, Representative. And I'm going to close with you, Representative Crawley, to address that same question.
Thank you. And so I'm going to echo everything that everyone said. I think if you can come and bring your own experience, so whether you work in the juvenile court system and working with children who have been abused and neglected, I know Representative Boggs and I both served as CASAs at one point in time. You can talk about how investments in, multi-system youth or in the foster care system or public children's services makes a difference for foster families and parents to be able to keep their children in the home, those preventative services. Or if you are a teacher and you understand that investments up front in education makes a huge difference. So if we have a pre-K for 3 and 4 year olds and they have an opportunity to have access to more sight words and social and emotional supports, that when they get to 3rd grade, before then, if they have issues with reading or they have some developmental disabilities, those things couldn't be identified beforehand and they can be on a track to success, and it saves the state money later on. I could go on and on about that, but I think, hearing those experiences, and bringing those to the forefront, whether it's sending an email, coming to provide testimony, or working with organizations like Groundwork, who's always advocating on the front lines for children and families and has an equity lens and making sure that we're targeting resources to the underserved or to those who need it most. But we always need your voice. Like at the end of the day, we as representatives, we work for you. And so, we should be able to lift up your voice in the State House and work together as colleagues to make sure that we can help the most in need. So with that, I would just say thank you all for being on, and I look forward to communicating with all of you who feel necessary to reach out. I would love to be a resource and work hand in hand with all of you to support your efforts. Thank you.
Well, thank you very much, Representative Crawley, and thank you to the entire panel. We appreciate your leadership, your listening ears, your patience, and your time with us, and your lived experience and a commitment to our youngest children and families. You've provided our audience with really key insights. I know they were hungry to hear from you and from the governor, both about your point of view and how their voice can be heard. So thank you very, very much. That concludes our legislative panel. It certainly won't be the last time you hear from Groundwork and from our participants today, but thank you so much, and we look forward to working with you during this budget process. All righty, so that concludes our legislative panel. We're going to spend the last 15 minutes of our webinar engaging with you about how you can get involved, and I'm gonna hand it over to Julia. We're gonna play a short video for you to take a break from hearing some of our voices and hear some of your voices here first.
In this moment, our youngest children and families need us more than ever. Children only get one chance at childhood. The first 1,000 days of a child's life lay the groundwork for their healthy development and all of their later learning. Because of COVID-19, Ohio's most vulnerable children have spent 1/3 of those precious days enduring the stress, the trauma, and financial hardships that are overwhelming their families, caregivers, and communities. You know the stories that policymakers need to hear. Your voice can persuade them to support our youngest children and families. We need you to make this moment a movement.
When you start sharing your story, other people will listen. And not only will they listen, but opinions can change.
Please know that your stories and hardships that you have endured during the pandemic is important.
We advocate for early childhood education so that our students can have the same opportunities as any child across the state.
We must continue to call, write, and tweet our congressmen, policymakers, and anyone that will listen.
One of the things I've done is made little postcards with the kids' artwork that says, "We matter."
We've met with statewide representatives as well as went to the Capitol.
Start discussions with church family members, your neighbors.
And the stakes are too high for us not to act, too high for us not to engage, and too high for us not to advocate.
Let's make this moment a movement.
Let's make this moment a movement.
And let's make this moment a movement.
Thanks everybody for taking that short look into the video we created to help inspire you all to participate in advocacy. So you know how Groundwork is working to build out this movement during the state budget process. I want to briefly share our budget priorities that you can count on our voice for, in addition to many others in the prenatal to 5 space. So first, one just guiding principle that we want to share with you is that as we evaluate all the investments in young children and families, we are doing so with an equity lens. We're applying data to support targeted investments that advance equitable outcomes, that eliminate barriers to access, and reflect the impact of COVID-19 based on race, rural geography, certainly age of the child, and other determinative factors. So advancing equitable outcomes is an overarching goal that we are evaluating all in state investments through. Our next priority, or perhaps one of our first specific policy priorities, is to keep Ohio working by expanding access to quality childcare. We heard from all the legislators, certainly in the governor's budget. There is a real, true need to lend our voices to both sustain and protect funding levels and investments in our publicly funded childcare, which is our high-quality, publicly funded program that serves young children while their parents are working. In addition to securing the integrity of our Step Up to Quality system and those funding levels, we are asking for more. We are asking to expand eligibility for publicly funded childcare from 130% of poverty to 200%. We know that Governor DeWine has increased it from 130 to 138. We are grateful and we are asking for more. We believe that we can get to 150% of the federal poverty level during this budget so that low-income working families can begin to feel some of the relief and support they so desperately need to be able to return to work, care for their families, and know that their children are in safe, nurturing, and educational, high-quality learning environments. Our next priority is focused on empowering parents through voluntary evidence-based home visiting. So, of course, over time, we have seen some historic increased investments in our last budget and the evidence-based home visiting program through the Department of Health Help Me Grow program. Governor DeWine has put an additional $1.9 million over the biennium in this program, and we think we can double it. We want to add an additional $1.9 million to the program so that we can not just serve 500 more families, but serve 1,000 more families over the next 2 years in this evidence-based service that has really been a lifeline for pregnant women, young children, and their families, certainly before this pandemic, during the pandemic, and into the future. So please join us in sharing that priority. Our next priority is to support healthy moms and healthy babies. So we have been tracking and protecting investments that respond to Ohio's infant mortality and maternal mortality crises and support the healthy development of young children. So healthcare coverage for pregnant women, young children, and young children in low-income families, infant vitality efforts, early intervention, early childhood mental health. And we are looking in this budget to expand and support the Department of Medicaid in implementing extended postpartum coverage so that pregnant women who are eligible for Medicaid, who typically only have services 60 days after the birth of their baby, can benefit from continuous coverage 12 months after birth. And we're working with policymakers to ensure that as Congress has provided some additional opportunity to act on that, that our state is the first in line to continue to make progress and lead in this space. So thank you for hearing from us about our budget priorities. I now want to just reiterate what you've heard from the governor, from Director Burre, from Shannon, the leader of Groundwork, from our legislative leaders. Every single one of them, we didn't script them. They have told you they need to hear you and that your voice matters. They expect to hear from me. They expect to hear from Groundwork, and we will be there every step of the way. But your stories of the work you do, of the families you serve, and those of you who are families on the line, your stories matter the most. So our team at Groundwork has created a really unique opportunity to make this moment a movement with a 5-day virtual advocacy challenge that if you are on the line, you can participate in. I promise you. You need 5 minutes for 5 days. We're asking 5 minutes for 5 days beginning next Monday. You'll have the opportunity to easily, in this 5 minutes of time, engage in some really cool, actually, advocacy tools to lend your voice to our priorities, to the priorities that you bring to the table that represent the needs of your local communities. And some of the ways we're doing that through these 5 days, the first day, we ask you to share a story via video. So if you have a smartphone, which I'm guessing you do, I know you do, or your computer, you can take a short video and lend your voice and tell your story in a way in this virtual world that can reach your legislators. On the second day, you will be asked to schedule a meeting with your policymaker. It's time. We've got to act. If they don't hear from you, who are they going to hear from? So you've got to schedule a meeting on day 2. We've got a very easy one-click process to be able to do that. Day 3, you're going to participate in a Twitter storm. You're going to engage on social media. It's one line, and I'm telling you, your policymakers are watching. Nearly all of our state policymakers have a Twitter handle. They are watching. Just like you're trolling your phone in the evenings and early morning hours, so are they. Day 4, you're going to send a letter of support to policymakers. We encourage you to create a letter of your own, but we have created easy templates for you to change and to modify, where you can, again, with a click of a button, be able to send a direct message to your policymakers. And on the last day, we are so thrilled and prepared to celebrate with you, to celebrate early childhood advocates, to share the videos you created and share the success and the difference you have made. So on the next slide, I'm just going to show you what you will see. If you registered for this webinar, if you're participating with us now, you will receive an email every day from us next week. And if you'd like your staff, your colleagues, your other folks in your community, other families in your community to participate, we will put a simple link in the chat box for you to opt in to this opportunity. This is an example of an email you're going to get Tuesday. So this is day 2. You'll see you have a very brief explanation of how you can be engaged. This particular action is asking you to schedule a short meeting with your representative. If you click that simple form, that link, it will take you to simply do that action and make that meeting request. We've also provided for you opportunities to both read and watch resources that will support this action. So read our case for support to help prepare you for your legislative meeting when it's scheduled. And then watch our video again, or share the video that we've shared today to help inspire you and support you with some talking points about what to share with your policymaker. Lastly, I will just say we value your participation and we're excited about it. And we are wanting to, as part of celebrating it, reward your participation. So every day, Monday, Tuesday, Wednesday, Thursday, if you participate in the activity for that day, we will have your email and we will randomly draw 5 people to receive a $25 gift card that will be sent via email to you in the evening of that day. So please participate, and we hope to reward you for your participation. At the end of the week, we're going to take everyone that participated in any of the activities throughout the week, and you'll be entered into a random drawing to win a small library of really high quality books that you can share with your community, your programs, the children you serve, that represent really quality stories that also share the faces of the children you serve. So they have diverse characters and share diverse cultures. We hope that you hear us when we say we value your participation. This is a fun way to reward you. But please, the true reward is seeing real results and action take place, and knowing that both in terms of the numbers that we show up with, the quantity and the quality of the communications we're having with our policymakers and the relationships we're building are making a difference and impacting policy and outcomes for young children and families. So with that, I'm going to just again say thank you, thank you, thank you. I'm sure our team will pop back on, perhaps with some of their faces, just to express thanks. We'll hang on the line for any quick questions you have. But just that last housekeeping reminder, you will get your emails for your 5-day advocacy challenge beginning first thing Monday morning. Please reach out to Groundwork staff. We are here to support you every step of the way, and we look forward to engaging with you next week. Thanks so much.